So what exactly are they looking at for reconciliation? Because it has to be based on some program that exists, is my understanding of reconciliation.
Yeah, and I am no master of the intricacies of reconciliation, so the honest answer to your question is I don't know exactly how far you could stretch it. What I understand is that it does in fact need to relate to the financial health of a currently existing program. Now, Medicare, of course, Medicare is in peril for a bunch of reasons, the aging of the population and everything else, but one of the main reasons it's in peril is because of the 12% annual increases in overall healthcare costs.
Well, so actually, they had a 5% increase this year, according to the CBO. Whereas what was it? Anthem just released. They want to raise their rates 30%.
Right, and that's
and that's in Connecticut. I'm not talking about it in California. I think it was Anthem. I'm not sure.
Well, I have Anthem. Mine
I think it was Anthem, and
mine only went up 15 this year.
Well,
which is less than the 20 it has gone up the previous few years.
Well, they're talking about a 30% increase right now. I just wrote on it the other day, and at the same time, you're looking at the scoring by the CBO. The CBO said Medicare went up 5%. Now, you're talking about a huge difference. Like I said, it's if you go from one to the other, if you make available to people who don't have insurance, that's a cost-effective way of getting them into the system, healthcare. Whereas there's no way on earth they can afford to pay. They're already they can't afford to pay it. They can't get insurance. There's no way you're going to get them insured by the. Generally you're talking about sick people, elderly people, people who are slipping through the cracks because the insurance agents won't insure them. If you mandate insurance, they're gonna charge them 2 or 3 times my rate or your rate just to insure them. So it's not a realistic solution. We have to give them some sort of into the system that's affordable.
Right. Look, I think there's 2 principled positions you can take with respect to insurance companies. You can be a single payer person.
I'm a single payer supporter.
Yeah.
I lived 28 years with single payer, and I understand there's a vast difference between single payer and the American system. In the Canadian hospitals, people walk around wondering how well the patients are getting. When my father got sick, I walked around wondering, is he going to get well? In the American hospitals, people walk around wondering how they're going to pay for it. And it's just it's just mind-boggling for me looking at the difference between the 2 systems. I understand that there's pitfalls to both systems. Nothing's perfect. No place is utopia. Even the best healthcare in the world in France has its faults.
Right. Well, if you're going to So there's probably 2 principled positions you can take. You can either say, I support a single-payer system, and you can point to the Medicare system and its administrative efficiencies, and say that's the way to go, as a lot of people do. Or you could say, for whatever reason, because Americans like a choice of products, which is a fact, I want to preserve a competitive environment among health insurance. But then if you say that, you got to say, but I truly want a competitive environment, which is not close to what we have right now, right? We have
a monopoly.
Oligopoly. Well, yeah, 1 or 2 players in most markets. So then you say, well, so what do we do to increase competition? Lift the antitrust exemptions, public option, and an idea that came from the other side, which is allow broader competition geographically. Right now, you got to be careful with that one. You don't want a credit card situation where everybody, flocks to the least regulated state and offers.
I don't want my health care from Montana or whatever state. I'm just, I'm picking a state, but I don't want my health care from a state where it's completely unregulated, and for $1,000 a month they'll sell me something that covers nothing.
But if you had a federal floor, if you had a federal floor that just said, here's the plain vanilla package that you have to offer every single American, no ifs, ands, or buts, and then you get into more complicated stuff like business practices and stuff, you could see your way to getting to a system like that, and that would be one way to increase. What we did in the House bill, actually, I thought was a pretty good compromise. We didn't want to set up a system where you had a flight to the bottom, to whatever state had the weakest regulation. So in the House bill, in addition to sort of setting this basic criteria that was a federally qualified plan, we created this concept of the regional compacts, right? So New England, the states of New England could come together to agree to allow people to compete within a region, sort of a happy medium. But what we're not talking about here. This is important. What we're talking about, but what we're not talking about is where the juice really is in cost savings, which is moving away from the volume-based model. Where everybody gets paid, the providers all get paid for doing more and better, and we as consumers, we spend 20 minutes on WebMD, so we now know the 5 things that we want, and we demand those. Health and wellness, is the cost to the system of the lack of health, obesity alone, type 2 diabetes, staggering.
Well,